Okay.
Rolling.
All right. We're going to start taking care of looking really on the front of the right side of your head, more on the frontal area here. Do you feel any discomfort? Just okay, good. Because it's supposed to be really settled around there. I'm just going to roll over this area and see. Do you feel any of those kind of crunchy feelings? Okay, I do. When any of the muscles get over tightened, they often lay down layers of calcium, which also is up in the base of your neck. So just going to work on sort of the base of your neck as well. And basically this is going to work everything from front of your head to the back. It's kind of a hologram. And it should be again showing on the right side more than the left. Can you feel some of that friction area? A little bit more kind of a bumpy feeling? Okay, good. That's what I'm looking for. Because I'm looking for it to smooth out. That sort of gives me an idea of what's going on. One of the things about this tool that's unique is that most times you're using a massage tool, there's no feedback. You just have a dead piece of whatever that you just rub and you have to use your hands to feel. And this actually feels for me. So this edge, what I end up calling much more the therapeutic or the diagnostic edge. So from here now we're going to move over to more of the side of your head and the side of your face, the temple area. No, it should be fine. The coloration change should show. And this should really go from the corner of your eye all along the side of your head. But you notice how there's a little bit more of a friction feeling? Yeah. Because your muscles, especially the temporal muscles just above your ear, you're noticing just as pain, but it's extraordinarily tight as well. Experiencing any difference in sides? Are they identical still? Okay. Now, do you feel that? Sort of kind of almost like a bumpy feeling? Yeah. And that's the base of your skull. So when your neck tightens up, that's where it's tightening up. Along the trapezius muscle, which is going along here. It's a much larger muscle, so. I'm going to follow this third muscle here. It really loosens up your face. Any different than the others? Okay. You can open and close your jaw and see if it's loosened up a little bit more on the right than the left. A little bit? Yeah.
Not too much.
Not too much, but some. So we're looking at some improvement there. How's the coloration? Excellent. Good. Now we're going to go back again to the frontal area. And one of the things that's nice about this is you can kind of change it to fit the shape a little better. So I'm going to try one of the different edges. Does that feel a little bit more intense than the other? Okay. Too much, or is it okay? Okay. Good. Because especially with pains like migraines, a little intensity in the hands is a lot better than all the intensity in the skull. So, but you notice each one of these can actually be folded and it pretty much molds itself to the curves of your hand. Are we seeing a left-right shift? Any left-right coloration shift? Okay. Yeah. I said you've been having these for 5 years.
Mm-hmm.
So I'm guessing any thought of everything happening overnight is not something that.
Nope.
Yeah. Not something that's easily attached to. I'm gonna bring this to the back to actually work on the back of the skull. See if we can bring it back. Even though it's covered by your hair, you can give it a pathway to go out. Bless you. I really want to work the temporal area. Again, opening your mouth. The muscles under the temples of your
About the same as
muscles.
previous.
Okay. Alright. How's your neck feeling? Tight, same, or not? Same. Okay, now what I'm going to do is have you turn here, a little more toward the camera there. What we're going to be doing is looking at this area here and actually working on the neck and shoulder muscle area. And this should improve some of the blood flow to your head. Again, tell me if it's too tight, if it's...
No, it's open.
Listening at the opposite side of your neck, seeing if it's going to get the left side of your face to release some. So we're actually releasing the shoulders because the trapezius muscle, which is the major muscle of your shoulders, 80 to 85% of it is below the shoulder blades. So if we can get that to release, then getting your neck to release, which is down here, should be quite a bit easier. Go ahead and move your neck and head a bit and see if it's, do you feel any difference in looseness? Okay. The left and the right?
A little, not
Okay.
too much though.
Okay. But some.
Yeah.
Too tight? Too intense? Okay.
Okay, yeah, a little bit.
Okay. And it's really about that much pressure. So that gives you an idea of how subtle the pressure can be. Under here? Okay. Do a little bit of that on the back of the knee to open up the front of the shoulder.
You have to into the camera.
Okay. And then
I mean the manipulation that you're doing. Yeah, we see it now.
okay. Okay, good. Yeah, the other was just I was just back and forth, back behind at the biceps tendon. This one is going to be more for releasing the pectoral muscle, which again should produce better color on the left side. Now we're going to go back to this leg. So we can do about the neck and shoulders on the right side. Okay, this.
Oh, that's fine.
Okay, how about your neck? See if it's
A little bit.
okay. Okay. Is there any tightness at the base of your skull?
There are usually always.
Okay.
Yeah.
So for the base of the skull, what I'm going to do is look behind and in front of the ankle. So I'm actually going to go right in the front in this area. Tender?
No,
Okay.
that's fine.
Okay, go ahead and see how it feels on the right side compared to the left.
It's still not the same.
Okay. And then I want you to tell me what it feels like here.
The same.
Okay. Now we're going to go back behind the ankle. Right, literally on the bone.
It's a little bigger.
Yeah. This is kind of where it connects now back to the neck. Feel better?
Mm-hmm.
Okay. I'm going to go back with this ankle, do the same thing, and then we'll go back to the hand here and see if it... So, again, we're going to go to the front of the ankle here to release the base of the spine. We're going to start in the front area here, just in front of and below the ankle. And then we're going to go right below the ankle here. And really pretty much try to loosen up some of the attachments of the muscles. And then here, even though it might be hard to see, it's actually stroking right behind the ankle, up into almost the Achilles tendon. Better? On the
A little bit.
little bit? Okay. Actually, I'm going to have to go from here we go. And then I want to bring that back up to here to follow that up along the bone, along the inside of the shin on this side, on the medial aspect. Okay.
Mm-hmm.
Better? On the neck? Okay. Alright, now we're going to go back to the right side of your face and head. Everything going from the base of the skull back here to the top of your forehead. And this side we feel a little crunchier than the other. Yeah. And one side doesn't feel worse than the other. Okay. Then we're going to go on the lateral side of the head. Let's see if I find the best edge for that. That crunchy point there. That's also the corner of the back of your head. Let's see if this makes it loosen up a bit. Hard to tell?
Mm-hmm.
face, we're going to go down the center line from here to here. With smaller edge. Back to here. I think I'm going to try working on your neck here a little bit. Chin.
Very little.
Okay. I'm going to go along the back again, right along the spinal column. Feel a lot of the crunching there?
Mm-hmm.
From the constant tension. Okay. And I'll go back to the other hand to get some more on that. Again, we're going to look toward the neck area represented on the wrist here. And you feel there's a lot of, literally they're called adhesions, where your bones are sticking together with the connective tissue to keep your head still. Your body's making sure that you can't do this or do this, because that always makes your head hurt. Way worse. And then some, again, on the side here. Should we go up here? Okay.
About 3 minutes and then left.
Okay. We can pop in another. It's right behind you. Yeah. And this is going to be the front of her neck on right side. See if that's loosening up any? Big with the other.
Yeah, a little.
Good. Okay. Content with a little. So it was about 8 before. Does it drop to a 7? Is it still?
About 7.5.
Okay. So it's about half a point taken down. So really about what you get from Advil.
No,
No.
from the
Naproxen?
Naproxen.
Okay, not even Advil, so you're getting about the relief you get from Naproxen. Without Naproxen, so. Do you tolerate that well? Naproxen?
Yeah.
Okay. And again, for the back of the spine. Do you have any pain on the top of your head as well?
Mm-hmm.
Okay. I'm going to go under here, mainly for, actually going to hook under the bone here, and sort of reach under, see what we can do to get rid of that top of the head pain. Uncomfortable?
Mm-hmm.
Not too much? Okay, how about the pain? On your head? Not much?
Mm.
Okay. So that's not usually where you feel it the most.
Mm-hmm.
Okay. Still want to disperse that. And then I'll come to the other side, do a little bit of that. And then color change. Okay.
We have about 1 minute left.
Okay. Okay. Take a amount of time.
Wait that 1 minute.
Okay.
1 minute. Is it dead or is it?
Well, it says less than a minute, but it's still counting down.
Good.
maybe flip to internal memory. So, alrighty. Now let's see. Is any difference?
Yeah, we take a
Break? Okay. Because then we can also check this, try doing this area directly as well. So it's going to warm it up at first, but then we can do some after shots.